Common symptom of heart attacks is upper body discomfort. This includes pain and discomfort in one or both arms or hands, the shoulders, the back, the neck, jaw, or upper part of the stomach. Another symptom is lightheadedness. It is essential that we supply our brain with oxygen and nutrients to function properly. However, during heart attacks, it may not be getting enough oxygen due to shortness of breath and trouble breathing. This can further cause the victim to feel lightheadedness and dizziness. Shortness of breath and trouble breathing is another common symptom, as your heart may skip a few beats. If the cut of blood to your heart is constant, your heart can stop beating completely. Other symptoms of heart attacks include nausea and extreme coughing, dizziness, flushed face, cold sweating, anxiety and fear, a weak, rapid pulse, shock, and confusion. The first aid in heart attacks. When someone is having a heart attack, the best thing to do is respond as quickly as possible to prevent the victim's heart tissue from dying. The first thing to do is to call 911 or contact EMS. You need to assess responsiveness and assess the victim's breathing and circulation. You can do this by asking them if they hear you, and then checking for their breathing and pulse. If the victim is unconscious and not breathing, start CPR by doing 30 compressions to 2 breaths until EMS arrives or victim shows signs of consciousness. If you are trained to, get the EED ready and use it. If the victim is conscious, the first thing to do is assess their responsiveness and loosen any tight clothing around the neck and chest. Assess them in taking any medication according to their physician's directions. If the victim is not allergic, help them in taking aspirin, 1 for adults and 2 for children. Taking aspirin will thin the blood and will open up the artery, helping prevent the heart attack from getting worse. Then, treat for shock and check the ABCs until the ambulance gets there. The doctor's aid. In the emergency room, doctors can diagnose heart attacks using a blood test to assess the heart's muscle damage, or an electrocardiogram to measure the heart's electrical activity. The patient is then taken to a high-tech cardiac room, where the doctors take additional tests to locate the blockages in the patient, such as cardiac CT, MRI, echocardiograms, angiograms, and chest x-rays. Cardiologists will proceed with an angioplasty, a procedure where the blocked artery is reopened by inflating it with a balloon.